Hi, I'm Nick Maselli. At TD Bank, we believe all citizens need to be informed about the important financial issues that affect their daily lives. That's why we're proud to support programming produced by the CAUCUS Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, TD Bank, the New Jersey State Nurses Association, and the Institute for Nurses, the Healthcare Foundation of New Jersey, founded by the Jewish community, the Give Something Back Foundation, providing mentors and scholarships to help Pell Grant-eligible students go to college and graduate in 4 years debt-free. And by Cone Resnick. Promotional support provided by NJ.com. Small news, big news, true Jersey. And by the New Jersey Chamber of Commerce, the statewide voice of business in New Jersey.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No. People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Welcome to One-on-One. I'm Steve Adubato. It is my pleasure to welcome to One-on-One Joshua Williams, Chair, Fashion Merchandising and Management Program at Berkeley College. Good to see you, Joshua.
Thank you. Thank you for having me.
Talk to us about this program and also the Brooklyn connection.
Yes. So the Fashion Merchandising and Management Program at Berkeley College has been around since 1970. Over the past 10 to 15 years, we've really been updating the program to be in line with what's happening in the fashion industry today. And part of that is really aligning ourselves with the industry, with the fashion industry in New York City and New Jersey, and trying to give our students an opportunity to really engage on a one-on-one level with market leaders, businesses that exist in, obviously, New York City is a fashion capital, but really giving them a hands-on experience through internships and with this new program, the Brooklyn Fashion Incubator.
Let's talk about there's a Macy's connection.
Yes. Macy's came to us last year with an idea of having us sponsor an incubator for designers.
What does that mean, an incubator?
It's an opportunity. An incubator is an opportunity for professionals, young professionals in general, who need business experience, who need some support, perhaps a little bit of hand-holding in terms of opening, running their business. Especially in fashion, there's so many different moving parts. Fashion's a very international supply chain. So just the idea of sourcing materials from China or India and then getting those manufactured in Colombia, it can be very overwhelming. So an incubator, and in particular this incubator, helps the participants understand how to engage with all these different pieces in the supply chain. And it also includes marketing support, helps them to get out into the community, to meet store owners, to meet the press, and just learn sort of how to engage beyond just the design process.
But Joshua, let me ask you this. The business side of the fashion industry, why can't someone just say, I love fashion, I'm into fashion, that's all I care about? Why is that not good enough?
We have our students, that's what our students come in with, a passion, and they see things on television and they're very engaged in terms of shopping. But the reality is that fashion, even though it's very sexy on the outside, it's a business. It's a multi-trillion-dollar business. And it involves, like I said earlier, a very large, complicated supply chain. It involves human resources, across the world. And we want our students to be able to understand that it's a very complicated, very complex business. And that's often overwhelming to our students, but I think it also becomes very exciting when they realize how connected the fashion industry is.
It's so interesting. Art and industry.
Yes.
So I think to myself, someone will often say, whether it's this artistic endeavor or the fashion artistic endeavor, right? Someone will say, I want to do that, or what they think it is.
Right.
Or they'll see, let's see one of the reality fashion shows, name one.
A Project Runway.
Whatever, right, on Bravo.
Yes.
Right? Our friend Andy Cohen there, right? We've had Andy on One-on-One. What was it again, Jackie? Now it's on Lifetime, thank you. or they want to do television, this art form. And I'll say to people right away, you have to learn the business side of it. And they'll say, what do you mean the business side? And 3/4 of our work is spent with getting the sponsors, putting the pieces together, the studio piece, the production piece. That's part of the art. Am I wrong, or am I making too much of this? The art of fashion is also the business, the art of the business. Am I?
No, you're absolutely on. I mean, one of the things that our students at Berkeley, they often realize very quickly that there's a math class that's involved, retail math.
You mean making a budget?
It's a pretty intense math class.
Yeah, right.
But you learn very quickly that part of the art of fashion is being able to create something that is affordable or on target for the consumer. I mean, it's not. Certainly, there's fashion where anything goes, but as a general rule, fashion is something that has to be purchased. So, you have to understand the marketing, you have to understand how to price it, you have to understand how to put it together.
How about the managing of the other artists involved in the fashion? How about the human side of this?
You know what? That's a big part of what we try to teach at Berkeley College.
How do you teach it?
We do a lot of group work in our classes, and we do a lot of presentation, a lot of communication practice, and it's uncomfortable for our students.
Talk about that as someone who's taught public speaking and still continues to teach people how to get through their anxiety and fear of speaking in public. You're talking about getting people to walk in and make a presentation.
That's right.
We're saying, well, look at my art. That's the presentation.
That's
not
right.
enough.
I was just saying to a class the other day, one of the most important things is to walk into a networking event and literally, if it's just one person, to talk to that one person and introduce yourself and what you do. And that's terrifying to them. So
Terrifying.
Terrifying. We practice that in class. I have them get up and say something about themselves, and it's ironic that oftentimes the hardest part is talking about yourself in a social situation.
Yeah. So let's talk about what happens for some of these students once they graduate and get to the next level. What kind of careers are we talking about here?
Well, we're very focused on the business side. So we're looking at anything from a merchandiser, a buyer, retail management, operations management. There's a lot of opportunities right now in the global supply chain and understanding.
What does that mean? Global supply chain.
Well, so fashion, of course, very little is made here in the U.S. So what happens is we'll design a product in, say, New York City in the design studio. That then gets sent to a manufacturer in China. That has to be communicated. There's cultural differences, there's expectations and pricing and all of those sorts of things. Somebody has to order the materials, so that's often coming from a different place, maybe India or Turkey, depending on what you're making. So that all has to arrive somehow in China, and then it has to be made. And of course, there's issues of human resources and fair trade and fair wages and environmental concerns.
A lot to learn.
Yeah.
Give me a minute or less on e-commerce. How do you teach that?
That's my area of expertise, and it's something that when I came on board at Berkeley that I wanted to ensure that our students were getting taught. In many ways, there's a lot of connections with what happens in the analog world in terms of our stores, and of course, there's a lot of differences. So our goal is first to show the fundamentals of retail, of customer service, of visual merchandising, how you present product to the customer. And then we start to talk about how that's different on a digital platform versus in a store. There was a lot of, at the very beginning, stores tried to do the exact same thing they were doing in a store online. And I think we've learned now that there's a coordinated effort for sure, but things are very different online in terms of how people shop and find products.
Before I let you give me a few seconds on the incubator program. What makes it a success and the students who are selected for it?
Well, we're very excited to have it on campus, and that's what makes it unique. Most of the Macy's incubators are at a Macy's store. What this does is it provides essentially a 24/7 design studio on our campus in Brooklyn. There's 4 students who are 4 participants in the incubator right now.
Is one of them a Berkeley student?
One of them is a Berkeley student, yeah, Pumalele. In fact, she was one of my students. She comes from Africa, actually, and she's come to the United States to study and to start her company. And it's been really wonderful, actually, to see her grow in the classroom, but also have her making her designs in Brooklyn on our campus. And so she's interacting with our students. Our students, in fact, have become interns for the program. So they're engaging one-on-one with the designers and with the directors of the program. And what we found is it's become a very kind of symbiotic relationship, you know, of actual design and conversation and business all happening on our campus.
Exciting stuff. Joshua Williams, Chair, Fashion Merchandising and Management Program at Berkeley College. Thank you for joining us.
Thank you.
Sharing a story that otherwise we would not know about. Thanks so much, Joshua.
My pleasure.
One-on-one, we'll be back right after this. Stay with us.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
There she is on camera, Elizabeth Nikol, a Senior Integrated Behavioral Health Clinician at Summit Medical Group. Good to see you, Elizabeth.
Thanks for having me.
One of your areas of expertise, depression. Define it, who deals with it, and how's it being dealt with?
So depression can show up in a lot of the ways that most people are familiar with, right? Sadness and sort of a lack of interest in the things that they used to enjoy. But then there are a lot of somatic complaints that go along with that, like exhaustion. People describe sleeping too much, sleeping too little. Sometimes people describe a difference in their appetite. They're eating too much, they're eating too little. Feeling like they can't focus at work, feeling like they're not as competent or motivated to get things done. And then, of course, in the worst case scenario, we're talking about people having suicidal ideation and really not wanting to be here anymore.
Depression. You know, it's not talked about a lot.
No.
To what degree is there still a societal taboo about depression?
I think there's still a societal taboo about mental health and mental illness in general. Yeah. So one of the things that I'm doing right now is working in primary care, actually, as opposed to in a therapy practice, to kind of help destigmatize getting help.
How?
So I will be brought into an exam room by a primary care doctor because that patient may have come in with a somatic complaint like headaches or their GI tract is acting up, but then they also start to share with their doctor that they're going through a divorce or their house is going to be foreclosed upon. And the doctor starts thinking, wait a second, I think something else might be going on here. But we know that if they simply hand a therapist's card to the patient, only 20% of patients actually follow through and call.
Why?
And well, I think part of it is stigma. I think part of it still in the society is I don't want people to know that I'm seeing a therapist. I don't want that in my insurance background. I don't want to run into somebody that might see me going into this particular building. And I think there's still an attitude that I'm strong enough, I can do it on my own. So by addressing it in primary care, the interesting thing about it is the doctor says, you know, I have someone on my team. I'm never called a therapist, who can help you work with different emotional stressors that you're having, difficulty in your family, troubles at work. Can I bring her in right now? This is of no cost to the patient, and most of the time, 90% of the time, they say yes.
Is that the term integrated medicine?
Integrated behavioral health, correct.
Explain it to folks.
So it's not something that's very new. It's been around for about 20 years, but I really think in the last 5 to 10 years there's been more studies in the literature. And it's basically using behavioral health personnel that are trained and working in a medical environment to be part of a team, usually primary care, but sometimes OBGYN, sometimes endocrinology, sometimes oncology, to actually just be there to field fires as they come in. Now, although this is great for the patient, it's also great for the physician, because let's say that you have 5 people waiting out in the waiting room and a patient comes in and they start to cry. That doctor has a choice of being there and being caring, which is certainly what they want to do, but it also means that they're going to fall behind for those other 5 patients that are waiting. So what they can do instead is say, wow, it sounds like you're going through a lot. Let us talk about your headaches first. And then I have someone who's on my team who can actually come in and talk to you about maybe some strategies that you could use to feel a little bit better. And so they're able to exit the room in a normal amount of time, and then I come in for the next 15 or 20 minutes and work on the other piece.
Now, your background is fascinating. You're a breast cancer survivor.
I am.
And we talked about this right before we got on the air. There is some degree of correlation between having cancer and depression.
Correct.
What is it?
Not only depression, I would say anxiety. I would say PTSD. I run 2 breast cancer support groups for our organization, and one of the things that we find is, especially when people reach the survivorship years, meaning they're no longer in treatment, and they're just going for their annual tests or their checkups with their doctors, and they feel like they're out on an island, and everyone else has kind of gone back to their normal life, but they're saying, I'm not okay. You know, I've just really been through something traumatic. I'm never going to be the same, yet I don't know what to do with all that I'm experiencing. So I'm really passionate about sort of survivorship programs and survivorship mental health, because I think during the actual diagnosis and treatment, these people have a lot of assistance and a lot of help, but sometimes afterwards there's not as much. So I've done a lot of therapy over the years with patients once they reach that survivorship mark.
Why do you care about this field so much?
I was brought into this field actually after 9/11. So originally I worked in downtown Manhattan.
You did?
For a large investment firm, and I was there on 9/11, and I was working in human resources. So I was already working with people, and I have always loved working with people, and I was a psychology major in undergrad. I thought at some point I might go on to be a therapist, but instead took a corporate route. And after 9/11, I watched therapists and social workers and people who did critical incident debriefings come in and meet with our employees. Luckily, we didn't lose anybody that day, even though we were right across the street. But people had lost family members, people had lost friends, and all of us were running from falling buildings. So watching people help really made me say to myself, wait a second, I need to be a part of this. There's something bigger. So I quit about a year later and went back to graduate school full time, and then within a month was diagnosed with breast cancer. So at that moment in time, my mom, who was with me when I was diagnosed, said, you're somehow gonna take all of this and you're gonna put it together. So I was a patient for almost 2 years as I went through cancer treatment, and I really care about the patient's experience. And you know, I think we can do an awful lot for them to help it be better and more valuable.
Before I let you out of here, someone watching right now says, I know someone, family member, friend, pretty sure they're dealing with some form of depression, serious anxiety, but I don't want to overstep my bounds, you say?
Overstep. You know, there's too many people, unfortunately, that we lose to suicide. There are numbers like that reported in the papers all the time. And suicide is the worst case scenario for someone that's really experiencing depression or PTSD. But as soon as you see that something's not right with your family member, try and get them to talk about it. If they're not willing to talk about it, try to get them to engage and leave the house. Go out to the movies, go out to dinner, have a friend come over. One of the things we know is that activities are incredibly important when somebody's depressed, because people feel better when they're active.
Yes.
So I think any family member should just not give up.
Or friend.
Or friend.
Don't give up.
Don't give up.
Even if they tell you to mind your business.
Absolutely.
Elizabeth Nikol, Senior Integrated Behavioral Health Clinician at Summit Medical Group. You just helped a lot of people. Thank you so much.
Thank you for having me.
I have a feeling you're put around this earth to help people. Appreciate it.
Hope so.
Stay with
Thanks.
us. We'll be right back right after this.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We're here at the New Jersey Nurses Association. These are the EPIC Awards. Some pretty special people and organizations being honored, including Claudia Marchese, Executive Director of Catastrophic Illness and Children Relief Fund in the state of New Jersey. What is the fund and why is it so important?
The fund, we are a New Jersey state agency. By legislation, we help New Jersey families, middle-class families mostly, with our overwhelming uncovered medical bills for their children. Any family in the state, no matter what their income is, if their medical bills for their child in any given year are more than 10% of their income, they can come to us for help. We can pay off their debt, or we can reimburse them for what they put out. We help families with
People don't even know about this very often.
That's why we're here. That's why I want to get the word out. So I'm so happy that they're recognizing us, and I work on this every day, getting the word out. We cover things that no insurance covers, like a modified van or modifications to home for accessibility, and then we cover everything that insurance has done all that they can. So there's co-pays, deductibles, it's a lot. No matter what the child's diagnosis is, we're here to help.
So the state of New Jersey committed to helping these families. The word has to get out about it. But the role of nurses are so important, right?
Absolutely. My marketing philosophy is to influence the influencers, and to me the nurses are on the front line with the families. They're the ones. So a family who's not having illness issues with their child, it doesn't sink in, they don't hear it, they're not going to retain that we're out there as a resource. But nurses are out there meeting families every day, and if they're aware of what we do, they can help us find those families that would be eligible and need our assistance.
How do families find you right now?
Oh, there's so many ways. I mean, they find out often from their providers, from their school nurses, from our commercials on NJ
JTV?
Yes, we have radio spots and we have some commercials also on other stations. And I'm out there every day talking to all the influencers. We talk to the mayors, the legislators, the pediatricians. So we're always interacting with those people who can reach the families.
The website is?
njcatastrophicfund.org.
The final word to everyone watching right now who says, I don't think that will ever happen to me. I bet a lot of families say that.
So many families, I mean, there are children who are born with illnesses, but we have accidents every day. It could be as simple as a broken arm. If you don't have insurance when it happens, then you're overwhelmed with the bills. And we have kids of every age, every socioeconomic, who something can happen to at any time. And even with insurance, many people with insurance still find that they have a need for our program.
Congratulations on your award tonight.
Thank you so much, Stephen.
Thank you for all the work you do.
You're very welcome.
We're here with Dr. Mehrotra, and the name of your foundation is?
It's the SKN Foundation.
Which stands for?
Sri Krishna Nidhi Foundation.
Explain it. What kind of work do you do and who do you serve?
We serve our local community, especially the minority community, in trying to educate them and improve their total well-being through that education that we do.
Describe this community and describe what would happen if your foundation wasn't there.
Well, I would hope that some other foundation would step in and do the work, but what we do is we try to empower the community in terms of how to take care of themselves. So we might have programs like Move It to Lose It, which focuses in childhood obesity and goes into the after-school program. We have something called the SCOPE program, which is the Special Needs Community Outreach Program for Empowerment. So helping families in trying to take care of themselves and how they can be a better part of society.
Talk about a night like this with the Nurses Association and why it's important.
It is an honor for us to be here and to be recognized for the work that we do. And it really gives us a boost of making sure that we are doing what we think that the community needs. So being recognized, I think, is the best part.
So being one of these epic awardees is a big deal, isn't it?
It is a huge deal, and especially to be standing here talking to you is an even bigger deal.
Well, we represent everyone in public broadcasting.
So it is a great honor to be here on the same platform with some of the great epic awardees out here.
Congratulations, Doctor.
Thank you so much.
Hi, Steve Adebato. We're here at the New Jersey Nurses Association. This is the Epic Awards. Some pretty special people are being honored. The gentleman you're about to see on camera, he's Kevin Rendino, chairman of the Partners for Health Foundation Board of Trustees and an Epic awardee. Congratulations.
And to you as well.
I try not to draw attention to that. I will get that rose, and it's not me that is being honored. It's our production team at the CAUCUS Educational Corporation and our partners in public broadcasting. But Kevin, let me ask you, talk about the work of your organization. What exactly do you do?
Well, our vision is to promote healthy and better living for the 15 communities that we serve around certain areas: mental health, dental health, homeless and hunger, and aging in place, as well as providing scholarships for nurses.
Let's talk about those scholarships for nurses. It's so important. Why?
Well, nurses have always been the backbone for health services in all our communities, whether it's in schools, in hospitals, visiting nurses in our communities. The system doesn't work without nurses. And so for Partners for Health, over the last 7 years, since 2008, we've awarded nearly $1 million in scholarships to 450 students that went through the Mountainside Hospital Nursing School. And we're pretty proud of that.
You know, actually, last year we partnered with Partners for Health, the Homelessness Initiative, in connection with the Montclair Film Festival, the film Richard Gere put out dealing with homelessness. Talk about why that initiative is so important.
You know, we live in an affluent area in many of the communities that we serve, and yet there is an underpinning of need, both in homelessness and in hunger. For example, in hunger, whether it's the Human Needs Food Pantry or Tony's Kitchen in Montclair, we do a matching grants program at the end of every year. Every dollar that they raise at the end of the year in their campaign, we match. We raised over $200,000. So that's a good news, bad news situation. It's good news that we're able to raise the money for the food pantries. It's bad news that there's such substantial need because we have a lot of people in our communities that are either hungry or homeless, and we need to fix that.
How did someone like you, and with your background, I mean, you're involved in finance and business, get involved in a foundation like this?
Wanted to give back. Dr. Sorger, the late Dr.
Marty Sorger.
Marty Sorger, had asked me, who was on the Partners for Health board, asked me if I wanted to go to breakfast, and the next thing you knew, I was on the finance committee, and then 2 years later, they asked me to become chair. And it's a great organization. It's giving back to the communities. We're all lucky to have the lives that we have, and we certainly need to give back, and this organization gives back in a lot of ways. This award for me tonight is not an award for me. It's really an award for Partners for Health, and we all get a lot of psychic income for all the good work that we do.
Finally, let's talk about the role of nurses. How important are nurses, particularly post the Affordable Care Act?
Really, really, really important. And for example, Mountainside Hospital is actually closing its nursing school, and that's a problem because the demand for nurses is even greater than it used to be. That's why we are going to start a new scholarship program towards the end of this year, where we're going to continue what we've been doing over the last 7-8 years, and we're going to extend that to other communities. So Bloomfield College, Caldwell University, there's students there that are needing and deserving of scholarships. And
they have big nursing programs.
They do have big nursing programs. So all the work that we've done in the past for Mountainside Hospital, we're going to start moving towards Bloomfield College and Caldwell University, and we're really, really excited about that because, as I said before, system doesn't work without nurses. We've all been in hospitals, we've all been in doctors' offices, and nurses make you feel good, and they're the caretakers and the givers, and it doesn't work without them.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, TD Bank, the New Jersey State Nurses Association, and the Institute for Nurses, the Healthcare Foundation of New Jersey, the Give Something Back Foundation, and by Cone Resnick. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.